What is the best treatment for a bulging disc? That is probably one of the most commonly asked questions that I get in my YouTube comments under my videos, and I have over 6,000 comments. People want to know, what should I do? What's the best treatment for my disc bulge? Whether it's an L405 disc bulge or an L5S1 disc bulge. What is the best treatment for a bulging disc? And we're going to dive into this question and answer inside this video right now. Hey there, it's Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally without pain and limitation. We also introduce our viewers to structural corrective chiropractic care to help with the stability and strengthening of the spine. So if you want these tips and strategies and learn about corrective chiropractic care, do subscribe right now by clicking on that red button below and tap on the notification bell. Turn on the notifications on your YouTube mobile device apps. And as well, let me know in the comments below that you subscribe, and I'll personally reply right back to you. So simply put, the best treatment for a bulging disc is the treatment that actually works for you. It's not a simple answer. It's not a simple question. I've had patients and tell me that they've done acupuncture and their disc bulge pain and their leg pain went away. I've had patients tell me that they did laser therapy on the disc injury site and that's helped them with their injury. I've had patients tell me that they did physiotherapy when physical modalities like ultrasound and differential, and they tell me that their pain actually improved. I've had patients tell me that they did injections into the disc area, into the inflamed area, injections to help with the relief of pain, and they tell me that their conditions improved. I've had patients tell me that they did surgery, and they tell me that their disc problem improved. So really, it's not an easy question to answer because it may be different for each individual person. Now, from my experience, I can tell you that chiropractic care has helped many patients recover from disc bulge injuries and also avoid surgery and also help them reduce their medicine intake. How is chiropractic unique and different? Well, chiropractic focuses on assessing the spinal alignment and correcting any spinal distortions that could be a contributing factor to the disc bulge injury. Now rewind and listen to that again. Chiropractic focuses on analyzing and discovering if there's any spinal displacements, distortions in the spinal alignment locally or globally that can actually be contributing to the disc bulge injury. So although chiropractic will help with the pain associated with disc bulges, whether it's local back pain, buttock pain, thigh pain, calf pain, numbness, tingling to the legs, it can help with that. More appropriately, chiropractic helps to stabilize and correct the distortions, the displacements, the misalignments of the spine, especially at L405 and L5S1 and the sacrum region that could be distorting and injuring the disc over time, causing tears and disc bulges. So the premise is to improve the spinal alignment, to improve the structure of the spine. In doing so, alleviate the abnormal loads on those discs that's causing insult and pain and inflammation and injury to the discs. Now, another thing I want to mention is that I often tell my patients to co-manage their condition with other treatment modalities. So even though I do strictly corrective chiropractic care in my office, I do refer my patients for laser therapy because I know that helps with the physiotherapist. I do refer my patients for massage therapy to help to break down the scar tissue on the muscles and relieve the muscle tension. I do also refer my patients for acupuncture because I know that helps as well. These are all co-management options on top of chiropractic spinal correction. And in some cases, people may need relief that comes from injections with medicine, like different anti-inflammatories and so forth. So they may need to see their medical doctor or be referred to a pain specialist. So we do want to co-manage our patients. Chiropractic is very useful, and a lot of times it's the one thing that really helps people because they've tried a lot of other things, right? Even though they're good things to try, other therapies, no one really actually corrected the spinal problem, and that's what the missing link is, I believe. But when you layer spinal correction with other co-management options and have a multimodal approach, including exercise, rehab, functional rehab on top of the structural rehab, then the success level of actually treating the disc bulge injury and underlying condition actually increases, where people the results we see is people improve with their pain, so pain is decreased, improve with their mobility, they're sleeping better, they're feeling stronger, they have more energy, they're walking a lot better, they're staying in the car, going for longer drives, they're back at work, they're happier, and they feel overall stronger and healthier. Okay, so like I said, it's not an easy question to answer. Really, it's the one that works for you, but do consider getting a spinal checkup. Do consider getting a spinal analysis, making sure that the spine is positioned properly, because even if you add a bunch of those other layers of treatments and you're not correcting the actual underlying spinal distortion, remember the disc is in between two vertebrae, right? The vertebrae in a series make up the spine. So you have to analyze the spinal alignment when you're treating disc bulge conditions. It cannot be avoided. So do get a spinal analysis. Do consider chiropractic corrective care, and if you want help looking for a corrective care chiropractor, I belong to a directory of corrective care, chiropractic, biophysics doctors. Let me know in the comment below and I'll just shoot you off that directory where you can look for a corrective care chiropractor trained in chiropractic biophysics in your city. There's many in the United States, some throughout Canada, and even other parts of the world. Now, disc injuries is a big loaded topic. I do have this really amazing video right here where you can continue learning, and what you can do is you can go ahead and watch that video right now, learn about the anatomy of disc bulge, why it causes so much pain and inflammation, and you get 4 great exercises that you can do that may help alleviate some of that pain associated with disc bulge. Go ahead and check out that video right now.